popular OTC drug linked to sudden vision loss. Recent reports have linked the over-the-counter drug Viagra, also known as sildenafil, and similar medications for erectile dysfunction to sudden vision loss. The condition associated with this is called non-arteritic anterior ischemic optic neuropathy, or NAION, a rare form of optic nerve damage that can result in sudden severe vision loss in one eye. While this condition can occur in the general population, research suggests an increased risk for individuals taking sildenafil and other phosphodiesterase type 5 inhibitors like Cialis, also known as tadalafil, and Levitra, also known as vardenafil. How does it happen? Come closer. PDE5 inhibitors work by increasing blood flow to specific areas of the body, such as the penis. However, they may also reduce blood flow to the optic nerve, particularly in individuals who are already at risk due to underlying health issues like high blood pressure, diabetes, or high cholesterol, or who have a specific anatomical predisposition related to their optic nerve. Please don't forget to like, comment, and subscribe to get quick updates. Risk factors: existing vision problems. People with a history of NAION in one eye are at a higher risk of developing it in the other eye when taking these medications. Heart disease and diabetes. Both conditions are risk factors for optic nerve conditions over 50 years of age. Older adults are more susceptible. High blood pressure and high cholesterol. These can increase the likelihood of NAION. Symptoms to watch for: sudden, painless vision loss in one eye, blurred or dim vision, a blind spot in the center of vision. If you experience any of these symptoms after taking Viagra or similar drugs, it's essential to seek immediate medical attention. In addition to Viagra or sildenafil, other drugs in the same class of phosphodiesterase type 5 inhibitors have also been linked to sudden vision loss due to non-arteritic anterior ischemic optic neuropathy, or NAION. These drugs include 1. Cialis, also known as tadalafil, commonly used for erectile dysfunction and sometimes prescribed for benign prostatic hyperplasia and pulmonary arterial hypertension. It has a longer half-life than sildenafil, which means it can stay active in the body for up to 36 hours. 2. Levitra or vardenafil. Similar to Viagra, Levitra is used for treating erectile dysfunction and has a similar duration of action. It is considered to have fewer side effects for some people, though it can still impact vision. 3. Stendra or avanafil, the newest PDE5 inhibitor on the market, designed to act faster with fewer side effects. It works similarly to other PDE5 inhibitors and has been associated with rare cases of vision issues. 4. Revatio, which is sildenafil at a lower dose. Although it contains sildenafil like Viagra, it is used at a lower dose primarily for treating pulmonary arterial hypertension. The risk of vision problems remains similar as it affects the same PDE5 enzyme. Mechanism and why vision is affected. PDE5 inhibitors, by design, increase blood flow by inhibiting the PDE5 enzyme, which is involved in regulating blood flow in certain tissues. However, this enzyme is also found in small amounts in the optic nerve and other parts of the eye. In susceptible individuals, inhibiting PDE5 can affect blood flow to the optic nerve, potentially leading to NAION, especially if they have other risk factors like pre-existing eye issues or cardiovascular problems. Other possible eye-related side effects. Besides NAION, other potential ocular side effects have been noted in relation to PDE5 inhibitors: bluish or tinted vision. Some individuals experience a temporary blue tint to their vision after taking these medications. Increased light sensitivity, known as photophobia, can occur due to altered blood flow and effects on retinal cells. Blurred vision and difficulty differentiating colors. Though rare, this can also be linked to the effect on retinal and optic nerve cells. Risk factors for NAION and PDE5 inhibitors. Individuals with certain risk factors are more likely to develop NAION after taking PDE5 inhibitors. These include age over 50. Older adults have a higher risk due to age-related changes in blood flow and eye health. Smoking can exacerbate vascular issues, increasing the risk of optic nerve damage. Diabetes and hypertension. Both conditions can compromise blood flow and increase vulnerability to optic nerve damage. High cholesterol and heart disease. Cardiovascular health plays a role in eye health. and compromised blood flow can lead to NAION, crowded optic disc. This refers to an anatomical variant where the optic nerve is more susceptible to damage due to its structure. It is a significant risk factor for NAION. Steps to take if symptoms occur. Discontinue use immediately. If you notice symptoms such as sudden vision loss, consult with a healthcare professional and discontinue use of the drug. Seek emergency care. Immediate evaluation by an ophthalmologist can determine the severity and potential treatments. Inform your healthcare provider of pre-existing conditions. Discuss your full medical history with your doctor before starting any PDE5 inhibitor to assess your risk factors. While these cases of vision loss are rare, being aware of the potential risks and seeking prompt medical attention if symptoms develop can help mitigate long-term damage. Does sex or too much sex cause any form of vision loss? There is no scientific evidence to support the claim that sex, or even frequent sex, directly causes vision loss. However, there are a few myths and partial truths about sexual activity and its impact on vision that have persisted over time. Let's examine the facts and address any indirect connections between sexual activity and vision health. Temporary effects due to strain or physical exertion. Increased blood pressure. During sexual activity, blood pressure and heart rate increase temporarily, which can sometimes lead to brief vision disturbances like seeing stars or momentary blurriness. This is generally harmless and subsides quickly. Vasovagal response. Some people may experience a sudden drop in blood pressure due to intense physical exertion, causing brief dizziness or fainting, sometimes accompanied by blurred vision. This can happen during sexual activity but is not related to long-term vision loss. Indirect effects from underlying health conditions, both sex and cardiovascular health. Since sexual activity is similar to moderate physical exercise, people with certain cardiovascular conditions may experience symptoms that affect vision, such as temporary blurriness due to changes in blood flow. This is particularly true for people with unmanaged high blood pressure or heart disease. Diabetes and erectile dysfunction. Individuals with diabetes are at higher risk of both erectile dysfunction and vision problems due to damage to blood vessels throughout the body, including in the eyes. In these cases, it's not the sexual activity itself, but rather the underlying diabetes that can lead to vision issues. Use of erectile dysfunction medications. As discussed earlier, PDE5 inhibitors like Viagra and Cialis can have rare side effects that impact vision, especially if taken frequently or in higher doses. These effects are due to the medication, not sexual activity itself. The myth of masturbation causes blindness. This old myth has no basis in medical science. Masturbation does not cause vision loss, blindness, or any other negative effect on the eyes. It was likely propagated as a way to deter certain behaviors due to social and cultural attitudes rather than actual health concerns. Severe stress or physical strain. In extremely rare cases, intense physical exertion, including strenuous sexual activity, has been associated with temporary visual disturbances due to blood flow changes in the eye or brain. However, this is not specific to sex and can happen with any form of extreme physical activity. In summary, there is no direct link between sex or frequent sexual activity and vision loss. However, underlying health issues or the use of certain medications related to sexual health can sometimes indirectly affect vision. If you experience any persistent or unusual vision changes, it is advisable to consult with a healthcare professional, as this could be a sign of an underlying health condition that needs attention. Please don't forget to like, comment, and subscribe to get quick updates. What are your own personal experiences? Drop it in the comments box below to help others. Thanks for watching.